In this video, I answer a common question I get on what is the best pillow for sleeping with someone who has constant neck pain and tension. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a chronic pain treatment expert with over 15 years of experience, specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of drugs or medications. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick disclaimer on why I make these videos. I make them not to entertain, but specifically for anyone who has been dealing with chronic neck, shoulder, elbow, or wrist pain for at least 6 months. Tried just about every type of treatment, been lied to, overpromised, underdelivered by the current medical model in hopes of giving some real answers as to what is going on and get to the root cause of the problem to get some long-lasting pain relief finally. Now on to the video. All right, so what am I going to cover in this video? First is, why does the neck pain feel worse by the end of the day and right before bed as well? Tips and strategies to help alleviate the neck pain, and the best pillows to use to help the neck not get worse during sleep. So let's get right into it. So I talk about this stuff all the time. Over time, you develop this stuff in your muscles, in your fascia, pretty much everywhere. It's this stuff called adhesion, also known as scar tissue, and it really acts like a glue inside the muscle. So over time, with bad postures, stress, staring at a computer all day, working at a desk all day, not moving enough, maybe moving too much, the muscles get constantly contracted and stretched. They don't get enough blood flow. They don't get enough oxygen, and it sends a signal to the brain that there's an injury here, even if you didn't have a direct injury. So the brain and body starts pumping out these cells called collagen, but the collagen fibers aren't like fully cooked. So it's just like a bunch of garbage that gets in there and forms in the muscle. When it happens, it just kind of looks like somebody just threw a bunch of glue inside there, some sticky stuff, and just sticks everything together. When it happens, the first problem it does is it causes the muscle to get less flexible, and then eventually it gets weaker as well. So as the muscle needs to be able to stretch and contract to generate force and movement through there. And a lot of times what happens is when it gets all this adhesion, it can't. So it first starts off with like decreased range of motion, but then eventually that whole area becomes weak as well. And then what happens is anything you do with your movements or your daily activities, your exercises, anything you do, it has some type of a force component that goes into it, a type of energy. So when that muscle can't generate the force or handle the force of the pressure that's coming in there, it usually kicks it off to other structures around there. And a lot of times that ends up being like the bone, the cartilage, the disc, the tendon. And that's where you end up getting a lot of things called like degeneration, degenerative disc disease, cartilage damage, all these things in their bone spurring because the adhesion started first and then loaded up the muscle. Then what happens over time is as that adhesion gets bigger and bigger and starts to spread out, there's all these nerves in the body. And there's actually, I think there's like 156 different areas where what's called a nerve entrapment can occur. So muscles need to stretch and move how they're supposed to, and nerves as well. Nerves are built with like 15% of extra slack. And what happens is as that adhesion gets bigger and bigger in the muscle, eventually it gets stuck to the nerve as well. When this happens, you get some symptoms like some numbness, some aching, some burning, some tension, where things just don't feel right. And a lot of times when a nerve is inflamed, it gives you a little bit of a higher pain level where you notice it more and more, and it's causing bigger issues. Then the next thing that happens is when the nerve is entrapped and there's issues in there, the muscles around the area, they actually engage in what's called a protective tension, where they tighten up to try to protect that area because they want to take the pressure off of the nerve. Because if the nerve gets compromised or stuck, it messes up a lot of things. So the body will sacrifice a lot of other things around there. And then you also end up seeing changes in the posture. Some people they say they might have their head forward or their shoulders rolled forward or something like that. That change in that posture is really the body's way of trying to unload that nerve entrapment because it's the main thing it wants to protect. And if the nerve is stuck, nothing else works. So the body sacrifices a lot of other things to kind of work around there. Then as I said, when you have all that nerve entrapment and you have all of that adhesion in the muscles and the ligaments and the fascia, that force is going somewhere else. And a lot of times, especially for chronic neck pain, like we're talking about in this video, it ends up going to what's called the disc. So the disc is in between your bones and your neck, and it's really like a good shock absorber. It can handle like pressure up and down. But over time, what happens is when you don't have strength or flexibility in the surrounding structures, now that disc starts to slide and grind on itself. And when that happens, it causes a lot of issues and starts causing some micro damage to the disc, not like a direct, like you blew out your disc one day. It just happens over time and builds up over and over again. And a lot of times when people are having disc issues, you might have one of those days where you wake up and you can't turn your head. It might be really sharp. And you're just like, oh, I might have slept on it wrong. And a lot of times when discs are annoyed and angry, they actually do this thing called like a referral pain, where they shoot some pain like down into the trap, into the mid back as well. And people usually think they have a problem with like a rib out or some problem with the trap or the rhomboid, but a lot of times that's a referral pain of the disc getting inflamed. Discs are usually a little worse in the morning because when you're sleeping, gravity isn't acting on you as much. So the disc is actually a little bit bigger. It's about 20% bigger in the morning. So if you have things in there like some minor tearing of these fibers in here that are called annular fibers, and then this jelly-like substance in the middle called the nucleus, it starts to kind of squeeze out. And when it squeezes out, all these annular fibers in the middle part of the disc, they're really sensitive to pain. They're really sensitive to inflammation. And when they get inflamed, everything just really locks down. So a lot of times people feel a little worse in the morning because that disc is a little bit bigger. Then as they start to move around throughout the day, it does feel a little bit better. If you get up and move around, it's not bad. Maybe your neck is a little sore throughout the day at work, maybe a little more painful. But then say you go home at the end of the day and you go to lay down, you're really sore. You can't get a comfortable position. It just feels, your neck feels heavy because now all that inflammation has built back up in the disc. And that's why you're feeling it more at the end of the day as well. So what happens when all this inflammation sets in throughout the day? First thing is it puts you over what's called symptom threshold. So if your body noticed every little ache and pain throughout the day, you wouldn't be able to do anything. You wouldn't be able to focus. You'd go crazy. You'd lose your mind. So it decides what it wants to look for. But what happens is when you have the adhesion and then you stack up the nerve entrapment, then you stack up the disc injury, then all that inflammation sets in, it hits that trigger point, which is called your symptom threshold, where your body starts to notice it. That's when you get the pain. The pain is your body saying, hey, I don't like what you're doing. You're doing too much. It wants to get your attention. Then what happens is that inflammation just gets stuck in there. And then you got that constant soreness, that constant stiffness all over, regardless of what you do. And another problem that happens is when you have a lot of adhesion, it actually limits the blood flow. So blood can't get in with all the things to heal it up and give it the nutrients it needs. But what else happens is all the waste product gets stuck in there as well, and it can't get out. So it pulls inside the muscle around the disc. And that's why these problems continue to progressively get worse, regardless of what you do. And you really feel like you can never feel like pain or the discomfort can ever get better, regardless of what you do. You might have a day or two where it's okay. I tend to see this a lot in my people and clients that, work a desk job where they're stuck all day. A lot of times they feel pretty good during the weekend because they're up moving around doing stuff, but then back on Monday, they're back at their desk. Everything starts over and it's just like a never ending cycle. And they'll try all sorts of things to try to get it better, massage it, stretch it, get adjustments, take a bunch of different creams and pills, do all these exercises. But the problem is it's not actually addressing what's really causing the issue in there. And as I said before, it's not just the tissue. It's not just the tissues and the structures. Yes, it's the adhesion in the muscles and the nerves. It's the discs and the joints and the tendons, but also other things can contribute to the inflammation. Maybe your stress levels, your diet, maybe you eat like crap. Maybe you drink too much. Maybe you do all these things. You just live a life of, just opulence and just having too much fun all the time. You're going to get a lot of inflammation as well. I see that from food choices. I see that from not drinking enough water. Basically just being a human, that all kicks in as well. And then you just continue to stack those blocks up in that inflammation cycle. And you're just constantly stuck in this never ending neck pain where some days it's really bad. Some days it's just sucks, but it's never really seems to go away. So what are some tips and strategies to help alleviate the neck pain naturally? First is just get the tissue healthy with specialized adhesion treatment. I talk about this all the time. That's exactly what I do, what the providers who are trained in my system call the peak injury treatment method. We specialize specifically in finding and fixing nerve entrapments and adhesion in the muscle, breaking it down effectively. We get proper depth, proper tension. It's a very focused and specialized type of treatment. It's not just like a basic massage or an adjustment or a stretch. It really gets in there and breaks that down effectively so the muscle can move better, function better. Then you get blood flow, oxygen in there, you get the waste product as well, and then you get some long lasting pain relief. Once we do that, then we actually do want to build up some of the strength in the neck. The neck has a core in the front, just like your low back. And a lot of times these muscles just get really weak from just being in bad posture. So when we clean up all the muscles in the back that are loaded up with that adhesion, then we strengthen up in here. And then we also strengthen up in the mid back so you can hold your head in a better place throughout the day and not just feeling like you're slumped over at your desk all day, just being like, oh my gosh, it's the only position that can make my neck feel better for like a little bit. Then we're just mindful of your posture and your breathing. A lot of times people end up breathing through their muscles in the neck, and those are really only supposed to be used when you're like breathing really heavy. But a lot of times we use these as our main breathers, and that just puts more adhesion, more pressure on the nerves in the neck and everything, and really just watching the posture as well. The problem, what happens with a lot of people is they know they have bad posture, so they think they just need to correct that posture by like being mindful of where they sit and where they are. But the problem is that muscle is so inflexible, so weak. You try to hold in that position, it doesn't want to do it. So you got to get that muscle healthy first, then build the strength up. The order really, really matters. And next is just inflammation reduction lifestyle. Drinking more water, figuring out which foods are inflamed to you, maybe taking some supplements, maybe not eating like crap all the time, maybe cutting back on your alcohol consumption. All this stuff nobody really wants to do, but it makes a really big difference. And it continues to take some of those blocks off your plate so you can actually function better. So I have two pillows that I recommend for each one of my clients to get started. This first one here, it's called the Tri-Core Sleeping Pillow. It's not as custom as other pillows, but it's really easy to just adjust to it to begin with. It's a very simple design and nothing crazy about it, but it really helps in the beginning. And I usually recommend this one to start with everyone because it has like a lower price point. I think it's anywhere from like $30 to $40, which really isn't that much. I've seen people pay hundreds and hundreds of dollars for pillows that really don't do anything. And we really like to have people use this as a starting point when we're getting the treatment done, we're making changes just to kind of hold the work we do in between. And it helps that sleep just be a little more stable, a little more comfortable so that that disc and those joints aren't put in a bad place and you're not laying down as much inflammation. Next pillow I recommend, and this is the one I use myself, I've been using it for years. It's called a 𝘠𝘠𝑒𝑡𝑖𝑐A pillow. Now, it is actually more custom to the size of your neck and your shoulder. You actually get measured from your ear out to your shoulder blade, and I think they have like 6 or 7 different sizes around there. So it is a little more customizable to the position. It is really good for people that sleep on their side. And you sleep on the side here, and you can see how everything in this photo stays like very neutral and very natural. That's how I like to sleep on my side. But it is very good if you sleep on your back as well. Your head can kind of rest in this area, and then you have that support back there through the neck. It is a little harder to get used to. Usually it takes about a week or so because when you're sleeping in a new pillow in a new position, it kind of messes with your brain and your body, and then you're kind of like tossing and turning. But if you can get through that first week, it can really help and put you in a good spot. It does have a higher price point. They can range anywhere, I think, from like $80 to $120, but still really not bad for what it does. And what I like to do is I like to recommend this one after we're done doing all the treatment and the lifestyle changes have been fully made. It really keeps it in a good place from where we are. I don't like to start with this one because it is a little more extreme from where we are. That's why I usually start with the Tri-Core pillow. But all in all, you probably be out about $150. But that $150 is an amazing investment because it's going to keep the treatment you do holding. It's going to limit the inflammation. It's going to help you sleep better. All that's worth way more than $150. So that's all I got in the video. If you want to get some help, you want to get out of chronic neck pain, you're tired of dealing with it, The best providers in the world for treating chronic neck pain naturally are trained in my system called the peak injury treatment method. And when you've had enough of chronic, annoying, and downright frustrating neck pain that never seems to go away, then reach out directly to us and request a no charge injury consultation to get some real answers as to what is going on and on the path to long lasting pain relief. Links to request a consultation are included in our profile or wherever you are watching this video.